Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
To the High Performing Dental Team, and we are podcasting live from the Rocky Mountain Dental Convention. And so if you hear a little bit of background noise, it's just because there's a lot of people roaming around our podcast pavilion today. But I have two special guests with us today with a really critical, important topic. And so I'm excited to introduce, I have Dr. Mitchell Gardiner, who presented, did you present yesterday and today?
No, I presented yesterday on periodontal ligament injection.
Oh, okay.
Anesthesia. And today, along with some wonderful attorneys, I had Ryan Donahue from Hall Booth Smith in Atlanta and also Colorado and the Western states, and this Joe Jaga, also another partner in the firm. We did a simulated mock dental malpractice trial.
Oh, it sounds... You make malpractice sound fun.
Well, we had a good time this morning, and it's always much more fun to do it in a classroom environment than in the courtroom, which we don't ever want to show up in it.
For sure. And then you brought your counterpart, Ryan Donahue, who is an attorney, a dental and medical malpractice attorney from all over the country. And welcome.
Thank you. It's always an honor to be here. I think we were here a couple of years ago. Right, Mitch?
Yes, we were.
Yeah. Thank you both for being here. So since you presented this morning, I love the idea of doing a mock trial, and you talked about malpractice. So if I was sitting in your class, what would be like the top 3 things that I'd be able to take back to my practice and really make some good changes to help protect my doctor? What would be like the top 3 things I could take away from your course?
As the clinical dentist, I'm going to start, and I would tell you what we tried to show. We showed an actual malpractice case. It all centered around the records. The dental records of the case are really the evidence that has to either support standard of care on the part of the dentist, or they don't support that, and then we have a problem defending in court. And the reason that I took part in this is I do expert witness work as well as my clinical dentistry. So my job is to understand the standard of care, try to teach jurors that in these cases. The 3 most important things that I think people, and today, believe it or not, there were probably as many hygienists as dentists in the course, and it was a sold-out course. So there were a lot of people there who wanted to hear this. Ryan and I and Joe wanted to do this because it's so much more, 1, informative, 2, fun, and 3, anxiety-free to do it in the environment we did it in. What we tried to show is how important really the evidence in supporting us in saying that we have met standards of care are, and having ancillary professional people like dental hygienists there who do so much good documentation work is very important. So they saw today in this particular mock trial how the whole centerpiece of what we talked about was on the records themselves.
Yeah.
And I want Ryan to comment somewhat about that too, because as a defense attorney, these are the most important foundations that he will do to build his defense.
Yeah, documentation is so critical, yeah.
Yeah, I would add, I think one of the most important things that we're seeing now, and I think people walked away from was, not just documenting the medical records, but also the text messages, the electronic forms of media that are out there that dentists are using to communicate, and how those can be used against them, and how they should be sometimes part of the chart. And so we have to be careful with what we text. We repeat as colleagues.
Oh, interesting.
Patients.
So do you feel, let me kind of add on to that a little bit, do you feel like the practice is missing the documentation, or are they documenting it wrong?
No, I think they're documenting in most cases appropriately. It's just now they're supplementing it with a text message, or supplementing it with an email, all those electronic forms of media out there.
Okay.
And some of those times, those should make their way in the chart. And the other times, they shouldn't, but you got to be careful with what you receive to other colleagues.
Okay.
Because plaintiffs' lawyers are asking for those yet.
Okay, interesting. That's really a good point.
So to add and you asked me, Dayna, what are the other several points that we wanted to have people understand today when we did a mock type of trial? I wanted our dentists and our staff people to understand the type of questioning that we're going to face when we get to trial, and the difficulty in answering questions when we don't have the documentation to back it up, because our memories will not serve us properly with that. And we did that today, and that they saw Ryan question me quite extensively and quite at length about the deficiencies in the treatment that I supposedly provided to this dentist. And a couple of people many people commented after. They said, well, that was a pretty torturous time that you spent. And I said, no, it's not torturous when we do it in the classroom environment. It's horrible when we do it in the courtroom environment. And Ryan, I'm sure, can add to that.
Yeah, I think one of the most popular sayings that we hear in the dental office is, if you didn't write it down, it didn't happen.
Yeah, and we talked about that today, how that's a misnomer. And people always think that. But, if you're documenting the essentials, whether it's electronic or written or something else, I think you're fine. It's just, that's a preconceived idea that a lot of plaintiffs' lawyers put out there.
Okay.
And they're always asking depositions at trial. If it wasn't documented, it wasn't done.
Yeah.
I know healthcare providers and dental providers cannot put everything possible in the chart. It's just that's really essential, of course, in treatment.
Okay, thank you for clarifying that, because I do feel that that's kind of a saying that we say a lot, and I appreciate you clarifying that for us.
But I would tell you, Dayna, that I work under the premise that that's not a true statement, because I review an awful lot of dental records for malpractice cases. And saying, if it's not in the chart, it didn't happen, we know that is not true. However, it's now a much more difficult part of our job to prove that it is true. Now remember, the documentation is the memorialization of exactly what happened in the office between the patient and the doctor. And it incorporates so much. It starts with the medical history, which is our real foundation of a good dental record. And I teach courses in documentation, medical histories, and I pretty much try to challenge dentists every time that I teach a course in medical history, asking them, are your medical histories thorough, complete, honest? Forget whether we read them or not.
Yes.
Let's just start with the premise, are they complete, honest, and thorough? Now, most dentists will answer that to me. I try to make them so I think they are. And then I'm going to spend the next half hour showing them why that is a really inaccurate statement, that our medical histories are only the very beginning. Once we have the patients fill them out, then we have to really investigate how true, honest, and accurate and thorough they are. And most dentists will find, well, they are lacking in so many areas. I don't know if Ryan would agree, but I'm curious to hear what he has to say.
I just want to add on to that, Dr. Gardiner, that I love that you brought up the health history, because all of you know how much I stand on, a stool and preach about health history. One of my biggest pet peeves about the health history is the word no changes. If I see the word no changes on your health history, oh my gosh, the wrath of Dayna will come down.
Well, that's part of what we talked about half the trial today was, the documentation contained within the health history, whether or not this particular patient was allergic to a particular drug or not, and it was an incomplete record. And so, and I find significantly kind of gloss over the medical history, dental history, and just kind of focus on what's the patient's complaint and not really focus on what really has happened before. So I think it was very educational to me. I think the jury really saw that, or we had a mock jury, then we had the real, but I think they really saw that. Don't you agree, Mitch?
I would certainly agree with what you said. And Dayna, I'm glad that you said that it stresses to anybody who's in this arena, whether it be the defense attorneys like Ryan or me as an expert witness, the medical history is the rock solid foundation for treating patients safely. I cannot tell you how many serious cases we have that center on incomplete, unsigned, unread, undated, medical, up-to-date medical histories. And for me, that is where everything starts in the dental documentation.
Thank you. Oh my gosh, I'm so happy to hear you say that.
Well, if you really want to see how bad it can happen to you, we take for granted that almost all of our patients do okay in the dental office. But all you need is one episode.
Yeah.
One episode where something goes wrong and you look back at the medical history and said, excuse me.
No, it's okay.
Gee, why didn't I see that? Why didn't I understand that? Why didn't I call a specialist? Why didn't I get a referral? Why didn't I get medical clearance? And then all of a sudden you say to yourself, I could have saved everybody a whole world of grief. And it really starts right with the medical history. That's the documentation. If it's there, we know we can at least practice safely with our patients. Do you agree, Ryan?
I would, and we can also defend the case based on that as the starting point all the way through. So, when I get a case, I start at the very beginning. What am I looking at? Looking at the medical history documentation that supported it, and then kind of progress there. It is key to the entire successful defense of the case.
And go ahead.
Well, Dayna, what I was going to say is, our office staff people, our dental hygienists, our registered dental hygienists are typically the best note takers.
Yes, absolutely.
Communicators in the office. They communicate better than dentistry typically because they typically will spend even more time than we do. And for some reason, patients are more comfortable with them. They're not as nervous with a dental hygienist. They are more open, more honest. Dental hygienists get an awful lot of information that dentists don't get. And it's not because dentists aren't entitled to that information. It's because, one, dentists don't use their ears as much as they should, and hygienists do, and hygienists spend the time to do them. And it's very funny. When I always do this to see what people will do. In the courses that I'll teach, I'll say, now listen, I want you to be able to spend enough time to take a good medical history, which takes time. It takes a great deal of time, and I want you to get paid for it. So I'm going to give you a dental insurance code that you can write down, and you'll get paid for taking a medical history. And everybody's got their pens out, ready to write it down.
I love it.
And I'll tell you the code.
Tell us.
D0000. And they laugh like you because they know I'm being facetious, I'm being sarcastic. We do not get paid to take a good medical history, but it pays us back 10 times over, 100 times over. You want to comment on that, Ryan?
No, I think you're 100% right. I mean, just think of taking a very detailed and comprehensive dental medical history versus how much time you're going to spend at trial sitting next to me in the defense table.
Agreed.
Where you're away from your practice and you're not going to be able to see patients during that period of time.
Yeah.
The pain, the headache, the stress, and everything associated with it. So the payoff is tenfold just to document, and like you said, just do it.
Yeah, agreed. So, oh my gosh, this is such good information. And I have a couple follow-up questions. Now, do you have a recommendation as to how often the office should have the patient do a health history and sign it?
All right, so I present this always in my medical history and documentation courses, and let's see if Ryan agrees with me.
Okay.
Medical histories need to be reviewed at every visit.
Agree with that. 100%.
And they need to
yes.
be documented
Yes.
at every visit, meaning reviewed medical history.
Yes.
And there are 3 cardinal questions to ask your patient to get a complete update, because patients sometimes are not on the same page with us. They don't understand that maybe going to the hospital for a stent in their heart is important to us. Many times they'll say, oh, by the way, I went to the hospital and I had a stent put, but that's not important to you. Well, yes, it is.
Yeah.
We need to educate our patients about that. But the 3 signature questions you ask: have you been, don't say physician, have you been to a doctor since you've been to my office last? Because many of them, they don't know what a physician is. They know what a doctor is. Have you been to a doctor since I've seen you last?
Okay.
That's number 1.
All right.
Have you changed or taken any new drugs or medications, or for that matter, supplements,
Okay.
herbs, since I have seen you last? That's question number 2. Question number 3. Dayna?
And, well, I was going to say, talk about medications. And then
And number 3, have you been in the hospital since I've seen you last? Now,
So that's different than have you seen a doctor? That would be another separate question.
that is correct. So
Okay.
the first one, have you seen a doctor? 2, have you changed any drugs, medications, or supplements since I've seen you last?
Okay.
Number 3, have you been to the hospital since I've seen you last? And let them spend a little time answering each one of them, because many times they will forget, oh, yes.
Exactly.
And that's the door that opens for you to go through it, to then get them to complete that medical history on a review basis.
Okay.
Ryan, anything there?
Completely agree, and just make sure you document that particular conversation in the medical record, because it's key. Because when litigation starts, the dentist, of course, is going to say, I had that conversation, and the patient or the plaintiff is going to say, we never talked about it. And then it goes back to what we talked about before: if it wasn't documented, it wasn't done, which is what's going to be argued by the plaintiff's attorney. So document, I can't stress enough, that particular review or renewal of the medical history and dental history.
I love this.
And the second question you asked me, Dayna, was what would be the standard of care for getting a complete, updated, new medical history? Well, I would want our dentists and our staff people who are listening to think about the following. Every single time you go in the hospital, if you're unfortunate enough to have to go, they will make you fill out a brand new medical history. It doesn't matter if you've been there a month ago. Now, the standard of care should be no more than 2 years in the dental office. You need to have a completely new medical history, not reviewed, but filled out by your patients and then reviewed by you.
Okay.
And put into the part of the dental record. If you do not, and I can tell you, if you do not follow that, I have seen it in court, and I want to ask Ryan what he thinks about it, but I have seen in court where even though doctors have said, dentists and doctors have said, reviewed medical history, no changes, without a new, complete medical history filled out by the patient in a quick turnaround of no more than 2 years, it will be considered not a updated medical history. Ryan, what do you say about that?
Good advice.
Yeah, I completely agree with that. Every 2 years, there should be some type of documentation, completed form.
Okay.
It's there in the chart that we can see it. You know, the only other thing I would add too is we're starting to see some of these dental practices now are doing the dental forms on iPads.
Yes. Yes, that was going to be my next question.
And I think we need to ensure that that is transferred over into the chart, it's preserved, and you know, everybody's getting hacked these days.
Yeah.
Make sure that there's a backup, and that's all in effect too, because one good hack and all that's gone.
Okay, good. Good to know. So, so I had a follow-up question about, we are gathering form information, health history information on a link or an electronic form, so it gets synced into the software, but then it is really important that the hygienist or the doctor reviews that information that the patient filled out online with the patient in the chair.
And Dayna, what I'm going to tell you, my experience, most dentists who are busy will give very short shrift to the medical history. We're dental hygienists. We'll spend more time doing so. And my advice to you as a dental hygienist, if you work closely with your doctor, which I would hope you do, or if you're a dental assistant and you work closely with your doctor, you must make sure that the doctor spends enough time to review it. My dental assistant, who has been with me 35, 36 years now, will look at the medical history and ask me, Doctor, are you aware that the patient can have epinephrine? Are you aware that this patient is on this or is on that? And that is what I highly recommend, because in a busy day, there is somebody who will slip by that you won't see that. And that is the real, that is the keystone for making your entire professional staff work as a team to help you to really protect your patients as best as we can when we do their dental work.
The only thing I would add very quickly is you got to remember, as technology advances and plaintiffs lawyers are getting smarter on this, they're asking for audit trails of that technology. So they will know when you accessed it, if you accessed it, how long you accessed it, and what you do with it. So there's actually, they go back and there's the metadata, the data behind that.
Okay.
And they ask for that. So they will know whether or not you could say you accessed it, but the document will be something different.
Oh, okay, good to know. That's really good. Thank you so much. Oh my gosh. This has been so great.
John, that's all.
Oh my gosh. What do you want to talk about? What else do you want to talk about?
Well, I'm going to tell you
Okay.
the other area that I want to see if Ryan agrees.
Yeah.
Other area of documentation and discussion that is not documented in the records that really is essential for us as dentists is the informed consent discussion.
Okay.
The informed consent discussion helps to protect us as dentists from deviating from standards of care when risks that we are supposed to discuss with patients actually take place. Because the law will stay, and I'll see what Ryan says, but the law says that if we have not had a valid informed consent discussion with the patient, and if one of the risks, the inherent risks of what we do happens, then we have deviated from the standard of care. Now, if that risk has harmed the patient, we could be found guilty of negligence. So it is essential that the informed consent discussion is documented in the dental record, right?
Yeah, the other thing I would add is some states, you don't necessarily have to do it, but why wouldn't you?
Yeah.
Get the and don't just write discussed risk benefits alternatives in your clinic note. Have an informed consent is narrowly tailored to what the procedure you're doing. They put it in there. It just shows that you're really actively discussing things with the patient.
Now, let me ask a follow-up question. Do you recommend having an informed consent for every procedure that you perform, or just certain invasive type of procedures?
That's a really difficult gray area question to answer, but what I would tell you, my experience as an expert witness, and I'm curious to hear what Ryan says, is that the prudent patient rule is the standard for us. And what that means is that what is the prudent patient expect to hear from the dentist about the risks, possible complications of any procedure. So let's say we're doing a class 2 restorative treatment, or we're going to use an infraalveolar nerve blocker. The chances are pretty good that the inherent risks are going to be rather small. So we're not looking at having to go through an informed consent discussion with the patient about that. But if you're going to take out a third molar, if you're going to place an implant in the area of missing tooth number 20, where we know we could have nerve damage, we know in a third molar we could have a fractured jaw, we could have infection, we could have we could have several different nerves could be involved. The inherent risk is significant enough that is when you must have the conversation. So you need to use your clinical judgment about a procedure and about the inherent risks of that procedure. And if you use good clinical judgment, you'll know when you need to have that informed consent discussion. Rand?
Completely agree.
Great advice. Great advice. Thank you so much. My gosh, thank you for your time.
Well, we squeezed a 1-hour course into whatever time we
I know,
out there.
I know. We try and keep it about 15 to 30 minutes because that's about a commute into the office, and any last words? If somebody wanted to reach out to you, how could they find you?
Well, Ryan, you don't want to find Ryan. Ryan will find you. Ryan is one of the preeminent defense attorneys in the country defending malpractice for hospitals, physicians, and dentists. So you don't need to look for him. Go, he'll be called.
You don't want to find Ryan.
As far as me, I lecture all over the country at some of the biggest meetings on all kinds of things like standards of care. And we're always expanding what we teach by what we see. If it happens to somebody somewhere and I'm involved with it, I want to teach it to somebody else so that person can learn from it.
Yeah.
And, as a profession, we really are education-based. Dentists around the country and their staffs. I'm amazed when I travel around the country how many professional staff members come to meetings. Sometimes their dentist should be there, and I'll say to the staff people who I'm teaching with, I'll say, "Where is your dentist today?" "Oh, well, he or she didn't come today. They told me to learn about it for you." And I always tell them the same thing. You go home, tell your dentist next time, show up yourself. But, it's our staffs, they'll protect us. It's our education and continuing education that protects our patients.
100%. Thank you so much for your time today. Oh, my head is spinning. I got so much information today, and I know that my audience is just going to eat up this information and implement what you talked about. And I'm going to help them with their health history forms and their consent forms.
It is an art and science getting a good medical history.
I agree with you.
It really is. Don't forget what you learned in dental school. That's what they taught you how to do it, and then you kind of forgot it.
I know.
Listen, it's a privilege to be with you, Dayna. Thank you so very much. Thank you.
Thank you, Ryan. Thank you, Dr. Gardiner. And thank you to all of you. Now, we will have more discussions about health history and informed consents. And we're coming to you from the Rocky Mountain Dental Convention. Thank you so much for spending some time with us. And I look forward to watching your journey of becoming a high-performing dental team.